Hello, ATG, and good evening to you all. I promise to come up live again today. I'm sorry I'm a bit late. I know it's almost about, I would say about 20 minutes to 10 p.m. now. And most people are already sleepy, definitely. And some people are definitely in bed. But this is the best time. And this is anytime you do something, is probably the right time. And I know and I believe that tonight I'll be talking to somebody and I'll be changing someone's life today. My name is Dr. J, Dr. Alalade, and I'm one of your admins here at Ask the Gynecologist. I'm hoping my audio is very good and we are broadcasting simultaneously on Instagram and also on Facebook here. I'm definitely sure that you can hear me well. If you can't hear me, let me know so that I can improve my audio and people can hear me clearly. Moshe Bolatan says she's awake. Hello, Moshe Bolatan, number 14. And Olori Abisoyege, Omolara Bokini, Olubimi Alaho Oluwashino, Noble Queen UK, Noble Queen Kitana Cute, Oyin OJ Affordable, C Babe 26, Oluchuku Oguaka Ikweze. Good evening to everyone and welcome once again to Ask the Gynecologist. My name is Dr. Babaji Alalade and I want to admit here, I want to first of all celebrate you all today that you've made it happen for us. That is a year exactly we opened our lab at the ATG laboratories and it's been challenging, definitely, and it wasn't a smooth sail, but by the grace of God, we are where we are by you. We couldn't have reached here today without you guys supporting, present in our lives, giving us the boost, the joy to overcome all these challenges. And today is the beginning of a wonderful time, a new year at the ATG laboratories, and definitely too, at the ATG IVF Center, we celebrated 4 pregnancies. 4 people that had transfers 2 weeks ago, they are all pregnant today. Some did a test yesterday, some did test today. So almost basically we are close to or over 100% success rate. And definitely by the grace of God, I know there will be some valleys and highs and lows, but definitely God is going to give us an upper hand, and our grace and the grace of God upon us through you guys will make our IVF cases at the ATG laboratories bigger success. And through you, if you've been trying to get pregnant 7 years, 5 years, 10 years, I think this is the right time to come to ATG IVF Center to change your fortunes, to change your story, to change your dream. Ugueze Jennifer, my wonderful lady, you're here to pick up your book I sent to you 2 years ago. Get it in Lagos, okay? Princess Bright, Allah, Jane Opara, Adigun Temitokwe Ogumbi, and there's Gani Edache, Miss Suki, HR Self Steffi, Komalafe Adiola. So tonight I'll be talking about a special and important topic: the things you must do before you get pregnant and in the first 12 weeks of pregnancy. The things you must do before you get pregnant and in the first 12 weeks of pregnancy. So tonight that is the topic, and I can tell you something. If you have any friends that will benefit from this topic, get them to come and sit down, or if possible, tag them to this video so that they can watch. Hello, Faith Samson, Nikki and Nike, Princess Ijoma Favor. So, I still want to thank God for His mercies and His grace upon the people that came for the IVF, and also I want to congratulate all our staff members at the ATG IVF centers, and most especially the patients, the clients that had faith in us and that came to our center and they've done their IVF and their money was never wasted. I can tell you something, they will deliver safely in the next 9 months. At the end of the next 9 months, they shall carry their own joy, and we shall celebrate by the grace of God, I believe by faith, we shall celebrate our first ATG IVF babies here on ATG Facebook by the grace of God without fail. Ngoge Emanuela is watching from Cameroon. Onyiye Subieri, Ngupa Dorothy Audu, Temitope Omoshegbon Oseni, Victoria Jibiri Ibadode, Vivienne Dico Briggs, God gives a dosa, Sandra Enebeli. Thank you guys for coming up live. I really appreciate you all. Ogueze Jennifer, I can see my sister. You're there and you're there always. God bless you. Gloria Wako Konji, Vivian Dico Briggs, Awete Mtayo Christina, Afina Odun Tayo, Chinimba, thank you so much. And Doris is asking me, how are you, Dr. Jide? Thank you. I'm doing cool. Thank you, Doris John Apereshi. Bumi Onoyemi, Taiwo, Oluwa Mayowa Agbeja, Toyiba Okoyemi, Gloria. Thank you, Gloria. How are you doing, Gloria Okonji? One of our moderators here, super moderators. Adetutu Adegun, Onuyari Abolayi Lawal, and Miola Okoyemi, Gloria. Thank you. Olabenjo Olajumoke Omisade Niso Ekbo. Ajitumobi Vivian Blessing, Bumi Onoyemi. And over here on Instagram, we have people watching live. Flora Perfumery, Omire Onochie, Eguatu, Eguatu Ezenwafo. Thank you guys. If I've missed your name, apologies and so much apologies. But if I've called your name, thank you once again. And I want to say I love you all from the bottom of my heart. Princess Chinyere, if Chuku, Happiness Oluchuku, Princess Bright Alo, Bukenke Ade, Agbani Deborah, Agoro Antonia, Granny Edashi on Instagram. Good evening, Dr. How are you and family? As Ineos Finest, how are you? I'm fine, thank you, Ineos. God bless you. Biti Chinyere, Eddie Ume Kenny. Thank you guys. Ijoma Osai Uchendu, I'm doing cool. Catherine Edebo, Victoria Akpaba, James Precious Achiever, Anyawu, Precious Achiever, how are you today? Antonia Akpan, Oluwatoyi Elaine Esson, Ojolomi Oku Etise, Genevieve Ike, Adikanku, Oge Love, Princess Chinyere, Ifian Chuku, I love you too. Thank you, my sister, Princess Chinyere. Tricia Etomi Ebele, Joy Chidi, Ogwegu, Ogoro Antonia, Vera Michael, Edith Osemota, Grace Gracia, Grace Ganedache. We don't have a hospital in Abuja yet. We're only in Lagos, but we can refer you to one of our colleague friends in Abuja. But ATG IVF Center is only in Lagos at present, okay? Chioma Ogechuku, you are just here. I know we haven't started yet. We've spent about 5-7 minutes welcoming people. I'm going to start shortly. Now, whenever you want to plant a seed, okay, you first of all till the ground, you water the ground, you prepare the ground, you remove the weeds, you remove all those jabojantis, you make your soil, you till it, you turn it round. The same thing too, the womb of a woman is like a soil, ready to receive the seed, the fertilized egg. The womb needs to prepare itself, and the womb prepares itself by the work of two distinct hormones produced in the body, estrogens and progesterone. They get the womb thickened, ready to receive the eggs. That is why anytime you go and do scans at any point during your menstrual cycle, the thickness of the womb will be different. They keep changing because the womb's thickness keeps changing, ready to receive the eggs. No egg comes, no fertilized egg comes, the womb sheds again, you bleed, you start all over again. So the thickness of the womb will fluctuate all through at every point during your menstrual cycle. Menstrual cycle is every day, all the days in between, from the first day you see bleeding to the next day you see bleeding in your next cycle. So your womb thickness fluctuates, okay? Now, that is how the womb gets ready, waiting for the egg. Now, as your womb is getting ready, you too have to prepare yourself too. It's most essential and most important that if you're trying to get pregnant, if you have any other medical conditions, we treat you, optimize your problems before you get pregnant. Some people in the past, they've had operations before. A part of their bowel has been taken out, okay? And suddenly they want to start getting pregnant. It will affect their diet. So we have to work on their diet. So if you've had operation before, some part of your bowel has been removed, okay? If you want to get pregnant, we have to do a particular review with you, get you to see this consultant surgeon, see the dietitian to optimize your diet. So if, for example, you have sickle cell disease, there's some things we should do to optimize your iron level before you start getting pregnant. In most cases, if you're a sickle cell person, we give and ensure that you're on 1 milligram of folic acid at least a month before getting pregnant. For every other person trying to get pregnant, you're well and fine, no other medical problems. What you should do and what must be done is that you should be on folic acid or pregnant care at least. You should be on pregnant care at least 3 months before getting pregnant. People ask me, what sort of pregnant care should I take or should I be on before I want to get pregnant. Most pregnant care brands, okay, and most pregnant care varieties, they contain everything you need as a woman, for a woman to get pregnant. They contain the right amount of folic acid, all the other vitamins complex together to ensure that you have a balanced vitamin set during your plan and your journey to get pregnant. So your folic acid, what you need in your folic acid is already be installed in your pregnant care. In fact, your pregnant care contains more than folic acid. Pregnant care contains folic acid and so much more. So you should ensure that you're on pregnant care, you're on folic acid at least 3 months before you get pregnant. Like I said again, there's no particular brand of pregnant care or brand of prenatal vitamins that is better than the other one. Most are good and constituted to work better, but the most popular ones are the pregnant care. So if you can get your pregnant care, it's okay. Like I said again, your pregnant care contains folic acid, usually around 400 micrograms to 800 micrograms of folic acid. It's already been instilled into your pregnant care. So pregnant care contains all you need. For some people, they will need extra folic acid during pregnancy. Okay, pregnant care is prenatal vitamins. Prenatal vitamin, it means the tablets, the vitamins you take before you plan to get pregnant. Prenatal, before pregnancy. Natal in Old Latin means pregnancy. Okay, so prenatal means before pregnancy. Good evening, Eberechi. So you need to be on pregnant care. Now, like I said again, the most important thing in pregnant care is the folic acid. And the folic acid is not designed to make you pregnant. A lot of people that taking folic acid, they assume and they believe that folic acid is given to them to make them pregnant. No, folic acid is not to make you pregnant. Folic acid is to prevent damage to baby's spinal cord during formation in the womb. During the first 3-4 weeks of pregnancy, baby's spinal cord is being formed. And sometimes there might be some defects in the way the spinal cord is formed. Some spinal cord, most spinal cord, when spinal cord is being formed in the womb, in biology, it will open and close. Some people, it will not close completely. Folic acid is given to prevent that failure to close completely. So spinal cord is supposed to close. Some people, the skin on the spinal cord, they will be open. Can cause infections, meningitis, and other things, even paralysis in different forms and different degrees. So to prevent that from happening to a developing baby in the womb, we tell people to take folic acid before they get pregnant. Some people, they've had previous operation in their intestine, they're obese, or probably they've had children in the past, of children or family members, close relatives, blood relatives that have suffered in the past from spinal cord deficiencies. We give them folic acid, even higher dose. And when I say higher dose of folic acid, we give them 5 milligrams. 5 milligrams of folic acid is the higher dose. The normal dose of folic acid for anybody trying to get pregnant that doesn't have any medical problems is 400 microgram. But for people that are, they've had children in the past that have folic acid problem, or they have spinal cord problems, or any problem with their spinal cord, or maybe they are taking epileptic medications, or they are taking, or stuff like that. We give them higher dose of folic acid because we want to prevent neural tube defect. There are some epileptic medications that make women prone to have neural tube problems in early pregnancies. For such people, we give them high dose, 5 milligrams. By the way, you must know this. Folic acid does not enhance the growth of fibroid. I've had this talk before about 5 years ago, and the lady was arguing about the fact that folic acid will make fibroid grow. Folic acid does not make fibroid grow. Folic acid has got nothing to do with fibroid. Even if it has nothing to do with fibroid, I'd rather prefer fibroid to grow than my baby to have spinal cord problems, God forbid. So you must take folic acid. And there are many brands of folic acid, many brands of pregnant care, many brands of prenatal vitamins. Choose the one that works for you. Some of them will not work for you. They give you stomach upset, they give you constipation. Some of them, they contain other things that you're allergic to, like soya. Some people are allergic to soya. If you are not working with one, you can switch to another one. There are many varieties many types of folic acid. Now, if you're trying to get pregnant, you must know your genotype of your husband, or fiancé, or spouse, and of yourself. Don't go and bring forth children that are sickle cell. If you've seen children with sickle cell before that are suffering in the pediatric unit, you will not want to bring forth any. So this day and age, we have technology to know and to prevent sickle cell from being conceived. Use them available. But however, if for any reason you know two of you love each other, you know your ASAS, and you are okay with the risks, that is okay. But you should be aware what you're getting into. Okay. If you have fibroid, you can take folic acid. Folic acid has got nothing to do with fibroid. But I'm not going to argue. If you don't want to take it because someone has told you that you should not take folic acid because you have fibroid, it's up to you. It's your body. I can only tell you the best thing. It's up to you to now decide. So don't let us argue about it. If you got fibroid, you should take folic acid. If you have fibroid, you should take folic acid. Okay, that is important. If you have malaria, okay, in pregnancy or outside pregnancy, you must ensure that they are treated, okay? There are some type of food that you should not eat. Folic acid does not delay menstrual cycle. Folic acid does not cause infection. No. Folic acid does not cause or delay menstrual cycle. I beg you in the name of God. So stop bringing some funny theories that don't exist, okay? Things like this is not about medication. We know what we are doing here, okay? Now, malaria must be treated in pregnancy or outside pregnancy. I've seen people, they think that when they are pregnant, they should not treat malaria. Malaria must be treated whether you're pregnant or not, okay? Now, if you have kidney problems, history of high blood pressure, diabetes, all these things must be treated and made stable before getting pregnant. If you have diabetes and it's not well controlled, it can lead to miscarriage in the first 12 weeks of pregnancy, and they now think it's some people that are doing you. Nobody's doing you. This is common sense now. If you have diabetes, you must ensure that diabetes is treated and controlled, okay? Diabetes is not permanently cured, but it can be controlled. Poorly controlled diabetes will increase the risk of neural tube defect and increase the risk of miscarriage. In fact, if you have diabetes, you must be on 5 milligrams of folic acid all through pregnancy. And also, if you have a history of high blood pressure, it's important that your doctor review all your medications for your high blood pressure and switch them to the ones that are safe during pregnancy. Not all anti-blood pressure medications, not all medications for blood pressure are safe in pregnancy. Not all blood pressure medications are safe in pregnancy. The ones that are safe are usually the labetalol, the methyldopa, and the nifedipine. Okay, they are okay in pregnancy, but they are not the best to control blood pressure in pregnancy. Hence and therefore, if you're pregnant and we switch you to this softer medication for blood pressure, we should keep your blood pressure under control, under regular check all through pregnancy. By the way, I'm running a seminar this next week Saturday. Not this one, the next Saturday, and it's going to be on ovulation, how to get pregnant by using Clomid, how to get pregnant at the ATG IVF Center for IVF. So all this I'm going to run for you next Saturday. So if you're not yet subscribed for the seminar coming next week Saturday, go and subscribe now. And if you want to have a chat with me one-on-one, you can use the premium services. We have the platinum, we have the diamond, we have the gold, we have the monthly consult and the weekly consult service. If you're pregnant already, we have the antenatal group and the GTC group for people trying to get pregnant, and they are all available on public forum on Telegram. So join which one that suits you today. And if you're not yet subscribed for the seminar, it's time to. You're trying to lose weight? There's a book now on ATG by Fumi Salam. She runs daily regular exercise sessions for people on our page here. You're trying to lose weight, you must get our book. It all starts with habit. And you see, I've read the book, I got a copy here. There's so many things you'll learn in that book that will change your life about diet. Now let's continue. If you got, like I said again, if you got blood pressure problems, you must ensure that your blood pressure medications are switched to the ones that are safe in pregnancy, and your blood pressure is monitored all through pregnancy. And also we check your urine for protein all through pregnancy, usually every 30 weeks. You're diabetic, we must switch your medications to the ones that are safe. You have history of epilepsy, you've had epilepsy before, ensure that before you get pregnant, you're seizure-free, you're epilepsy-free, seizure-free at least 12 months before getting pregnant. It's very important. And if you got epilepsy, you should be on folic acid 5 milligrams. The reason is that epileptic medications, they deplete, they decrease, and they slow down availability of folic acid in the blood of a woman. And that will make your babies that are going to be conceived of, or you get pregnant for, to be deprived of folic acid, making them at risk of having spinal cord problems. Okay, so it's important that if you have history of epilepsy, you are on 5 milligrams of folic acid. Okay, now let's continue here. For questions, leave them, okay, until we finish. Dr. Esther is handling the antenatal and GTC group. If you want to see Dr. Esther, she's quite busy now. She's getting some things done, but she's available on the GTC group and the antenatal group on Telegram. Okay, thank you. Now let's continue. For questions, leave them until the end of this discussion. Now, so I've talked about epilepsy. Epilepsy medications, they have a way of decreasing availability of folic acid to a pregnant woman, and they can increase the risk of spinal cord problems. So therefore, you should be on this folic acid high dose, 5 milligrams. Essential, not changeable, not bargainable. Okay. Now, if you're pregnant, it's always essential that if you suffer from blood pressure problems, you've had previous miscarriages, 2 or 3 miscarriages in a row, you have blood pressure problems in pregnancy, you bleed in early pregnancy, placenta is always having bad function in pregnancy, you got a history of renal problems, kidney problems in pregnancy, or even outside pregnancy, you have a history of antiphospholipid syndrome in your family or in yourself, you should be on high dose of aspirin, 150 milligrams once a day. Okay, 150 milligrams once a day, at least a month before getting pregnant, and all through pregnancy. And you can even take the 150 milligrams aspirin in 2 divided doses, 75-75, but it's only for those that suffer from blood pressure problems in pregnancy. Folic acid 1 milligram is not bad. It's for those that got history of sickle cell. Okay, you got a sickle cell history, you should be on folic acid 1 month before pregnancy. This is what the Royal College of Obstetricians UK said, from the Royal College, not me. Okay, now all through your pregnancy, once you get pregnant, if you have past history of ectopic pregnancy, if you have history of endometriosis or history of disease or removal of one tube, once you get pregnant, it's always important that you do a scan at around 6 weeks to check that the pregnancy is in the womb. If you've had a previous history of ectopic pregnancy, it puts you at increased risk of ectopic pregnancy happening again. So therefore, how do you know if the pregnancy is ectopic? Ectopic pregnancy means pregnancy outside the womb. Pregnancy outside the womb can be pregnancy anywhere, that as far as it's not inside the womb. If it's in the tube, if it's just on the entrance of the tube into the womb cavity, on the cervix, in the tummy, on the ovary, as far as the pregnancy is not in the womb cavity, it's ectopic pregnancy. And ectopic pregnancy has a tendency to rupture that can kill because you bleed so much into your tummy. So if you have a history of ectopic pregnancy before, if you've lost your tube from ectopic pregnancy before, if you have history of tubal blockage and you've done HSG and HSG says that your tubes are blocked and suddenly you get pregnant, it's paramount, it's important that once you're about 5 to 6 weeks pregnancy, you go and do scan to check that the pregnancy is where it's supposed to be, not in the tube, but in the womb. The thing is that if you do a scan less than 6 weeks pregnancy, you probably not see much on the scan, because for scan to pick up pregnancy must be at least sizable to an extent. Okay, that is that. So blood pressure, you got blood pressure problems, you should be on and switch to the safer blood pressure medications from the time you plan to get pregnant. If you are not sure, if you're not certain about the fact that your doctor has switched you to safer medications from those epileptic medications, then it might be a good thing to be on contraception. So therefore, what I'm trying to say is that if you want to get pregnant, okay, You got all these problems. Poor controlled diabetes, poorly controlled thyroid problems, issue of epilepsy. Your medications for epilepsy that are not safe for pregnancy. You got issue of renal problems, renal transplant, kidney failure. You should start seeing your doctor at least 3 months before you get pregnant. And in fact, I would advise you use contraception until your doctor gives you all clear that you can start planning to get pregnant. I know people have questions now, so I'll start answering them, because a lot of people, they've been told stuff before that they're confused about, or maybe their friend or even they taught some things, and as I'm talking now, I'm obviously opening some can, and they're confused more. Favor in Chem is saying that, doctor, what if you can't take folic acid directly because of fear of vomiting? You put it in gari and swallow. That's okay, as far as it's entering into your tummy. Whether you swallow eba first and you now swallow the draw soup, or put draw soup first and now swallow the eba, or you eat them one together. As far as it enter your tummy, that's okay for me. Whether you put the folic acid inside the gari and swallow, whether you put it inside fufu and swallow, as far as it reach your tummy now, no problem. Okay, so choose how you want to do it. Do you want to swallow your gari before swallowing the draw soup, or put the gari before, or whichever one comes before, or everything go together? Is okay. How long does pain from degeneration fibroid last? Nobody knows. But in most cases, once you take painkillers, pain from fibroid will go away. But how long does the pain last? I'm not a prophet yet. Is aspirin safe for hypertensive patients with peptic ulcer? There are safer aspirins that are what we call enteric coated. If you got ulcer, you want to take aspirin, get the ones that is called enteric coated, EC. They'll put EC on the box. It means that it has been made safe for people that have ulcer. At what trimester should you start taking pregnant care? You start taking pregnant care before the first trimester, at least 3 months before you get pregnant. Don't wait until you get pregnant to start taking folic acid. But if you've forgotten, that's okay. Start taking it anyway. But ideally, in the most best of circumstances, you should be taking the pregnant care for at least 3 months before you get pregnant, and you take it all through pregnancy, at least for the first 3 months of pregnancy. Doctor, can someone with preeclampsia in previous pregnancy take aspirin to prevent it? Yes. In fact, if you had eclampsia before, preeclampsia before, you should be on aspirin 150 milligrams every day, at least 1 month before pregnancy, and for 3 months for all through pregnancy. It helps to prevent damage to the placenta from blood pressure problems. Okay. What about pregnancy conception? Any pregnancy, as far as it's pregnancy and it's produced and it's not fake, you can take it. It contains what you need. Okay. I would like to know what is something. Okay. Adeyeye Arinola, I've answered your question. Somebody with history of adenosis and previous surgery and failed IVF, get pregnant. What to do? You can get pregnant. For you to know whether you can get pregnant, we need to look at all your hormonal profile. We need to check your HSG, check your husband's sperm, check if you're still ovulating, check whether you're having regular sex. Then we put all these 4 together, then we'll be able to know what is the way forward for both of you to get pregnant. What is the permanent solution for PCOS? I don't know. If anybody says that there's a permanent solution for PCOS, that person is trying to rob you of your hard-earned money. Okay. The first solution to PCOS is that PCOS does not make you not get pregnant. Everybody, I've seen people with PCOS, they get pregnant, and I've seen people that without PCOS and they don't get pregnant. So PCOS increases the risk of infertility, but does not make you not get pregnant 100%. Okay. So for PCOS to be treated forever so that you don't have PCOS again, it's a joke. If you have PCOS, we can manage it, but to treat it completely, I don't know. I'm not yet in that level. Maybe we'll know in 10 years' time. Can someone have implantation bleeding for 3 days? Very unlikely. It's usually for 24 hours to 48 hours. But if you see bleeding and you're pregnant, go and check the test of pregnancy a week after. Okay? If you're more than 6 weeks, go and get a scan. What happens when you see pregnancy symptoms and you miss your period, but test is negative? That means you're not pregnant. Oluwafisayomi Merio. If you do test of pregnancy is negative, you're not pregnant. Or it means that you've miscarried 3 weeks ago. If you miscarry today and you do test of pregnancy for the next 2 weeks, it will be positive. Okay? So if you miscarry today and you do test of pregnancy tomorrow, it will be positive. Because you miscarry today does not mean that your test of pregnancy will be negative tomorrow. No, it will be positive for the next 2 to 3 weeks. So if you thought you were pregnant, you did test today is negative, that means that the pregnancy was miscarried more than 3 weeks ago. Okay, sadly. We're on Instagram here. There's a question on Instagram. What causes painful sex during ovulation? It's probably from the cyst, from the ovary that is ovulating. Yeah, it's very common. Doctor, can pregnant women give birth at 36 weeks? Yes, so anybody can give birth anytime. Okay. The question is that if you give birth before 24 weeks, is baby going to do well? Or 22 weeks, is it going to do well? But anybody can give birth at any time. But for us to say that your baby is fully developed, if you deliver vaginally at 37 weeks, your baby is full time. Okay, that is what they taught us. But anybody can get baby at any time. Okay, Sweet something on Instagram. How are you today? How long does it take to see period after miscarriage and evacuation? It can take about 6 weeks to 2 months. Okay. What is hysteroscopy surgery? Hysteroscopy surgery is basically we put a camera to look into your womb cavity. We put a camera to look into the womb cavity. That is hysteroscopy. Okay. Pregnant care. Anita Para. Any pregnant care, as far as it's original, is okay to take. I've said this over and over again. Any pregnant care, as far as it's original, is okay to take. Okay. Folic acid, 400 microgram is okay. 800 microgram is okay. 5 milligram is okay. Okay. But as I said again, there are some special people that they must be on 5 milligram folic acid by all means. Previous epilepsy history or taking medication for epilepsy. They have history of bowel resection, bowel surgery before. They've had children before that have spinal cord problems or family history of spinal cord problems. They are obese, okay, and they are on antibiotic medication. Can a woman of 44 stop seeing her menstruation after doing fiber surgery? Yes, it's possible. Oh yeah, man, that's your answer to your question. Sweet something, thank you so much, Jeff. Thank you so much, Sweet something, for your comment on Instagram. God bless you. I really appreciate you. Doctor, what can someone use to cure yeast infection during pregnancy? You can use canesten, pessary, or you can use clotrimazole. They're the same thing. What is the normal percentage each of hormones? I don't know what you mean by percentage. To join the seminar coming next week, which is the ovulation seminar and the IVF clubbing seminar, get registered now. There's a link on the screen now to subscribe and to join the ovulation seminar coming up next month. This is time to join into this seminar, because that seminar, I'll be taking you on a journey that you've never gone before. And I can tell you something. God is definitely here in ATG. And God is definitely there at the ATG laboratories. And God is definitely, without any iota of doubt, at the ATG IVF center. How can you say this if it's not God? It is not me. It's not the nurses or the doctors there. It is just God. And it's God's time. And it's your time to get pregnant. You'll be going to infertility for 7 years, so and so for 7 years. You've been crying. It's time to carry your own baby. If you've had failed IVF before, you've done IVF, you failed before, come and try ATG. Come and try God. Come and try ATG. It is not man. Come here and let your story be different. Doctor, your last question. What causes bitterness in pregnancy in the mouth? It's just pregnancy hormones. It's pregnancy. Doctor, is it advisable to take well woman joint taste a month before pregnancy? As far as it contains vitamins that are safe for pregnancy, as far as it contains folic acid, it's okay. Okay. What causes ectopic pregnancy? Infection, damage to the tube, and severe endometriosis. Those things can cause damage to the tubes. As far as the tubes are damaged and blocked, pregnancy will cause ectopic pregnancy. Okay. Victory, Igodala. Thank you. Causes skipping period. What makes your period skip after a fibroid operation is the operation. Maybe you have scar tissue in your womb cavity. Maybe after operation from fibroid, some people do have scar tissue in their womb, and it can make your period to be scanty or to skip. Doctor, is safe sex in first trimester? Sex is safe at any point in pregnancy. The only time sex is not safe in pregnancy is if you've been told that your placenta is low and is at a risk of bleeding. If your placenta is not low in pregnancy, sex is safe all through pregnancy. And in fact, for some people, sex is sweeter, safe during pregnancy. Sex is safe all through pregnancy. The only time your sex is not safe in pregnancy is if you're told that your placenta is very, very low. What if you have been taking pregnant care for 3 months and no conception? Like I said again, pregnant care does not make you get pregnant, okay? So if you're taking pregnant care for 3 months, you didn't get pregnant, and if you're still planning to get pregnant, continue it. But if you don't want to get pregnant again, you can stop it, okay? What causes constipation? When you don't drink enough water. If you're pregnant, you're taking some medications that make you constipated, like iron tablets, it can make you have constipation. Chondroitin safe in pregnancy is okay. I missed my period. You tested positive with 2 lines. It was faint. Later, you saw your period this month, and so and so. Victory, what's the question here? This month, you have pregnancy symptoms and you tested. So, it's either your victory, it's either you're pregnant or you're not pregnant, okay? Pregnancy does not come halfway. It's either you're pregnant or you're not pregnant. And if you don't test for pregnancy in the urine, it says positive and you're not sure, go and do blood test of pregnancy. We would know for certain. The blood test of pregnancy gives us result in numbers, and then we know whether you are pregnant or not. If someone is seeing severe pain in the right hand muscle, Igodala, I've already answered your question. No, I don't know what you want me to say. Do you want me to lie to you? Igodala, and Gloria, can you help us put the banner outside there and say pregnant care does not make you get pregnant, please? And help us put it out there. Folic acid does not make you pregnant. And help us put it out there. Pregnant care and folic acid are designed to prevent neural tube defect in pregnancy, okay? Or spinal cord defect. Thank you, Gloria. Can someone going for IVF take folic acid? Certainly, yes. You're going for IVF, you should be on folic acid. And if you're going for IVF, in some cases too, we tell you to take aspirin medications to help to make the pregnancy implantation work better. Doctor, you had failed IVF, you have irregular bleeding or heavy bleeding. I don't know what you mean. ATG IVF Center is in Lagos for now. ATG IVF Center is in Lagos for now, okay? Maybe we'll come to your environment soon, but we are still only in Lagos for now. If you know how much it costs to produce or to start up an IVF center, you know it's not easy, it's not a joke, but you can support us. If you have any way to help us to get IVF center in Abuja and Port Harcourt, definitely reach out to me, and then we see how we can go. And we can work with you, we can collaborate with you to make it a dream a reality. Okay? What's the cost of continuous something? The cost of continuous, I can't see it. So, all right. Endurance, that will be, what's your question, my sister? On Instagram here, someone is, Noble Queen, saying, can a woman with sacrilege have sex in pregnancy? I'll suggest no. No, you can. There's nothing to say you can't, but I'll suggest, if you had a sacrilege, you're pregnant, I'll suggest don't have sex, please. Okay? Is it safe to take amlodipine while trying to conceive? No. Amlodipine is one of the medications for blood pressure that is not safe in pregnancy. Amlodipine is one of those medications for blood pressure that is not safe in pregnancy. If you're trying to get pregnant, we should switch your medications for amlodipine to something safer in pregnancy. Like amlodipine is okay if you're not pregnant or trying to get pregnant. But if you want to get pregnant, amlodipine is not safe in pregnancy. Okay, so we need to switch it to something that is safer. Okay, some of the medications we switch you to are not as good for blood pressure in pregnancy, but they are still safer and they are better. You're having burning sensation in the evening, you got reflux. Go take Mismag, get some Gaviscon or some omeprazole. It helps with burning sensation at night. Okay? Thank you guys for being here today. I really appreciate you. And hope to see you again tomorrow. God bless you. And most importantly, love you all. And thank you for making ATG a reality. And ATG IVF Center is bubbling. You're trying to get pregnant. You've been going through all these challenges, trying to choose gender selection, family planning, family balancing. It's time to visit at ATG IVF Center and give us a trial. And definitely, God will not put you to shame. God no go shame us. Amen. See you soon. Love you all. Love myself too. Bye-bye.